into.
मैम डॉक्टर माइकल को मैसेज नहीं मिला शायद।
नहीं मिल गया उनको बता दिया मैंने। कंटिन्यू चैटिंग कर रहे हैं हम लोग। उनको भी बता दिया मैंने इनकॉग्निटो विंडो में जाने के लिए। आ जाएंगी बेटा 1 मिनट।
मैम वी आर ऑन एयर यहाँ पे ना। Let people are already redirected. Can you all hear us and see? Please update in chat box. Okay, great. Can you see us? Okay, great. So now we are going to go live. We'll start the event. Our presenters and people are joining. So before we begin the session, I just want you to know about this software, that you have a chat box, and kindly send your comments and questions on the chat box. And as you all know that Homeopathy 360 and Afghanistan Homeopathic Medical Association has organized this event, this revolutionary international webinar series. So we here welcome you all to the day one, and I am thankful to Master Hanneman for giving us this opportunity, as well as Mr. Manish Jain, the Director of Vision Publishers, Dr. Obaidullah Al-Hashmi sir, the founder and president of AHMA, NCP, LMHI-International, as well as all the speakers and the people who have been behind this webinar series. I'm really thankful to Dr. Kavita R. Chandak ma'am. She's a classical homeopath from Parbhani. She is the professor in the Department of Repertory from PD Jain Homeopathic Medical College, an international speaker and trainer, and the board member of Afghanistan Homeopathic Medical Association. So I'm here. I'm thankful to her for joining us, as well as I'm thankful to Dr. Hashmi sir, Ubaidullah Al-Hashmi sir. If you talk about Ubaidullah Al-Hashmi sir, he is the founder and president of AHMA, as well as he is the homeopathic consultant physician at Afghanistan, LMHI National Contract Person of Afghanistan, medical director and homeopathic physician at Afghan Mercy Hospital, Afghanistan. And he has received so many awards, presented so many papers, and organized so many international events and trainings. So we are glad that we have him here. I would like to invite him to introduce about AHMA. Sir, are you with us? Can you please on your video?
Actually, Dr. Nikhil has some problem. He restarted the new one, but he is not able to enter.
Ma'am, please tell him to open in incognito window only, new incognito window.
Yes. Okay.
He'll be able to. Okay. Dr. Ubaidullah sir. We'll just he'll join us in a minute, and then we'll start the session. Dr. Michael is about to join us. I hope everybody is excited to learn from Dr. Michael, the international expert, I would say, in dealing cases with cancer. So please have patience. I'm really sorry for the technical issues that had happened for today. Hope this won't be repeated. I'm so sorry. Dr. Hashmi sir, please on your video.
Sorry, please. Yes, please.
Please on your video, sir. Turn video on.
Okay. Done.
Thank you so much, sir. So please introduce about AHMA by the time Dr. Michael joins us.
Thank you so much, Dr. Yashika, for giving us this opportunity, and thank you, BJ and Homeopathy 360 for creating this special event, international event for understanding the homeopathy worldwide. This is Dr. Obaidullah Al-Hashmi, the President of Afghanistan Homeopathic Medical Association. I'm telling you only very short brief of Afghanistan Homeopathic Medical Association, because already we have wasted some time due to some technical problem. Really sorry for all participants who are waited for this technical issue. Thank you so much. Afghanistan Homeopathic Medical Association has been founded in 2018 in Afghanistan, Kabul base, the capital of Afghanistan. This organization is non-governmental and non-profit organization, which is working only for the development and awareness and regulation and for the betterment of homeopathy in Afghanistan and all over the world. We have initially we have started from zero, because in Afghanistan homeopathy there is no governmentally recognized this system in the healthcare ministry. We have done a lot of activities, and at the end of this webinar in the day of 15, I will explain everything in the details, but very shortly, let me tell you that we have very legend and special members of this AHMA, and we are really proud of all members, executive members. We need their support to success this association globally for the recognition, development, and the unity of all homeopaths in the globe. This association working right now in Afghanistan for helping the poor people, because homeopathy is one of the very cost-effective therapeutic system in the world. Approximately 500,000 people are getting homeopathic treatment worldwide. Recently, let me tell you one thing at the end. Recently, I have introduced this homeopathy in our President House and the Parliament of Afghanistan. The AHMA is also been registered in LMHI and also collaborated and associated with so many organizations nationally and internationally, like BJ, Phytolab, Baxens, CCRH, Ministry of Ayush, and Faculty of Homeopathy, and so many organizations has been linked with the AHMA. Our aim is to success this association only for the purpose of the betterment of homeopathy in the globe. This was very short scenario, and I will tell all the journey of homeopathy from last 2 years in my presentation in 15 of this month. Thank you so much, Dr. Yashika, for giving us this opportunity, and special thanks for Dr. Michael Frass to give us his special time and for being the executive committee member of this organization. And I want to say thanks to everyone, all the members, especially the executive members and the board members like Dr. Kavita, Chandak, and really proud of you. And if you people join us and work with us, I hope in near future we will recognize this system, and we will and globally, and we will work for the people and homeopathic therapeutic system to cure the different diseases, the uncurable diseases, with your help, with your knowledge, and with your talent. Thanks so much.
Thank you so much, sir. I think sir is joining us. By the time I'll just introduce him, and we'll start the session. So as you all know that we today have University Professor Dr. Michael Frass, sir, who is MD and Professor of Medicine at Medical University Vienna, Department of Internal Medicine, Division of Clinical Oncology. He is the Vice President of Ärztegesellschaft for Classic Homeopathy and Chairperson of WissHom Scientific Society for Homeopathy, Koethen, Germany. He is also the President of Austrian Umbrella Organization for Medical Holistic Therapy and an Executive Committee member of AHMA from Austria. He is a specialist in internal medicine and internal intensive care medicine and has accompanying cancer therapies of Austrian Medical Association. We welcome him as well as we are grateful to him on behalf of Homeopathy 360 as well as AHMA, Afghanistan Homeopathic Medical Association, for joining us. And his Combitube is included as the class 2A device in the guidelines of American Heart Association. He has evaluated esophageal tracheal Combitube that was produced by Coethen, Mansfield, Massachusetts, USA. So we are glad that we have him here, such a great personality and an expert and an organizer of international scientific congresses, invention, development and evaluation he has done of this esophageal tracheal Combitube, an ultrasound contact medium dispenser device. He has research interest in university research of homeopathy, and he's done various researches internationally and national at various levels. So we are glad that we have him here. He's presently he has an experience of being supervisor for homeopathy in AKH in Vienna and lecture on complementary medicine at University of Vienna, and various achievements he has achieved. He'll be joining us in a minute, so we'll hand over the session to him. Dr. Kavita, did you connect Dr. Michael, sir? Kavita, ma'am?
Hello, Kavita ma'am. You there?
Trying to connect. Just wait a second, audience. I am very sorry for this technical errors. Please wait for a minute. Sir is trying to connect. Kavita, ma'am. is joining in a minute. He is about to join. Kavita ma'am.
लिंक भेज दिया बेटा उनको ओके जी जी ओके हेलो एवरीवन गुड आफ्टरनून we are sorry for the technical issues as you all know that we all are homeopath we are not the doctor of technology we are just the doctor of human being so technical part is getting settled till then let me talk about Dr. Michael Frass. I personally know him since years and I spent a very good time with him at Vienna last year. And trust me, people can only watch him on the television in Europe. But we are quite lucky by having him today live with us, and he is going to share his fantastic knowledge with us regarding to cancer and how to handle the cancer cases. So please wait for him. Technical issues will resolve within few minutes, and we will go ahead. So thank you so much for bearing us. Just wait for 2 minutes. Thank you, everyone.
You please talk to him once and see if he's received the mail. I've already mailed him though.
Yes, oh, bravo. Finally, you are here. I'm so sorry for technical issues, Michael. So sorry. But happy to see you. Yes.
Yes.
So, before you came, Yashika already has given your introduction, sir, because we did not want to spend the time. And so, right now, I think I should hand over to Yashika and she will look after. Thank you, Yashika.
Thank you so much, ma'am. We are glad to have sir here, and Homeopathy 360 and Afghanistan Homeopathic Medical Association is very much thankful that we have a legendary person joined us today from Vienna, who we can see on televisions only. So we are glad to learn from him. And without wasting any more time, I would like to hand over the session to him. Over to you, sir.
So, thank you so much for this invitation. I'm very pleased to be a part of your conference, and I'm very happy that homeopathy is spreading out in your countries. So I'm very fortunate to have support from Dr. Kavita Chandak, who always takes care of elder confused professors. So the topic of today is additive homeopathy for quality of life and survival in cancer patients. So I was working, I'm just retired last year from the outpatient unit of homeopathy for cancer patients. It's a medical university in Vienna, in Austria. But I'm also the vice president of the Doctors Association for Classical Homeopathy, and the president of the Austrian umbrella organization of Doctors for Holistic Medicine, and chairman of the Scientific Society for Homeopathy in Germany. So, you know, there was also a lot of contradiction against homeopathy from the Vatican, and in 2009, can you understand me? It's okay. 2009, with a conference at the Vatican, it was organized by Professor Louis Ray. I think you are aware of his work with thermoluminescence in homeopathic remedies. So he did a very important publication, and it was fine to see that the Vatican also now does not assume homeopathy as a devil medicine. Now, just to let you know that homeopathic doctors are also interested in conventional medicine. This was my invention, or is my invention, with two colleagues. It's a device for emergency intubation, for intubation and efficient safety, and also making possible oxygenation in emergencies. So I did a tour also in India for several weeks, and this is some years ago when I was working at the intensive care unit at the Medical University of Vienna. And we put together our experience of homeopathy in intensive care and emergency medicine, and this was published together with Martin Bündner from Germany. So we are very happy that this publication has been now is now available in English language. Now, I'm very much interested in a constructive dialogue between conventional and homeopathic medicine. I think the problem is that my conventional colleagues are not aware of, or are not educated in homeopathic medicine, and also not in other methods of complementary medicine. And this is the problem, that homeopathy is still regarded as a negative method. Now, we also tried to introduce our research and our investigations into the European Parliament, and there was a session in April 1st of 2014. On the right side is Dr. Thomas Peinbauer. He was the head of the European Committee of Homeopathy for a few years ago, and he's still acting very much. You know, there's a recent publication on homeopathy published in a veterinary journal where he is also a co-author. Now, what is the scope of application of homeopathy in oncology? I think in our country, the main interest of patients is to alleviate side effects of chemotherapy and other types of therapy, such as radiation therapy. I think it's also helpful to solve blockades. It might heal secondary diseases. It helps to restore physiology. It strengthens constitution and enhance life quality. And I am also asking whether or not it might help to improve survival. So there is a publication by Rostock and co-workers in 2011 where classical homeopathy was investigated in the treatment of cancer patients. It was a prospective observation study of 2 independent cohorts. It was a prospective observational study, and cancer patients were assessed in with complementary homeopathic treatment, about 250 patients, and conventionally treated patients without additive homeopathic treatment, about 400 patients. And the patients were paired with the same tumor entity in comparable prognosis. So the conclusion was there was an improvement of quality of life, and the tendency of fatigue symptoms were decreased under homeopathic treatment. Of course, it would take considerably larger samples to find matched pairs suitable for comparison in order to establish a definite causal relation between these effects and homeopathic treatment. I think the main limitation was it was a comparison of 3 different of 3 different centers, not one single center. And this was the reason that we have done a similar study evaluating influence of adjunctive classical homeopathy on global health status and subjective well-being in cancer patients. And this was a pragmatic randomized controlled trials at the Medical University of Vienna. And we have published this together with Menachem Oberbaum from Tel Aviv. The head of the division of oncology was Professor Zelinsky. He had the idea to start with a additive homeopathic treatment in our institution. All cancer patients were treated conventionally by chemotherapy, radiation, and or surgery. Optionally, they could ask for, or they were randomized, for add-on homeopathy. And there were about 600 patients contacts per year. Now, we wanted to evaluate whether add-on homeopathy influences global health status and subjective well-being of cancer patients as an adjunct to conventional cancer therapy. The study was approved by the Ethical Committee of the Medical University of Vienna. Inclusion criteria were patients with an age over 18 years and prior to the first conventional treatment. Exclusion criteria were inability to comply with the study protocol and mental inability to fill out questionnaire, or also language problems. Now, a conventional elaborate medical history was done, a homeopathic history, including questions related to social and private circumstances. And symptoms given by patients were correlated with the science of homeopathic evaluation of remedies. Now, we should say homeopathic medicinal products. This is a new term, as recorded in repertories, in the Zentford repertory and or MEC repertory. You know, I'm a little bit old-fashioned, so I'm still using books, but of course, I also use computer programs. The statistical sample size calculation accounted for an expected dropout of about 25% of patients. A study with about 2 times 200 patients would give an 80% power based on a two-sided significance level of 5%. And there was a use of the multiple imputation method with 50 simulation runs and constraints between 0 and 100 to impute missing values for the second and the third visits. Now, these patients came for follow-ups every 9 weeks. It was a pragmatic randomized controlled trial. It included 410 patients with standard anti-cancer therapy, and the patients were randomized to receive either or not classical homeopathic adjunctive therapy in addition to standard therapy. And the setting was the Medical University of Vienna, Department of Medicine 1, Clinical Division of Oncology. It was prospective controlled. Randomization was performed using a computer-generated code. 200 patients received conventional treatment, and 210 patients were individually selected or received individually selected homeopathic remedies in addition to regular conventional treatment. It was an open pragmatic trial. There were no placebos used in the control groups. This was a big discussion before we started with the study, because some people said we should give the other group placebos, but in the real world setting, people not asking for homeopathic therapy also don't take placebo homeopathic medicinal products. So we said, okay, the second group is just an observational control group. Now we are influenced by the Swiss group around Dr. Spinedi and Wurster, and so we mostly use Q potencies with increasing potencies starting with Q1, but also C and LM potencies. The homeopathic remedies were prepared according to European Pharmacopoeia and Homeopathic Pharmacopoeia in pharmacy in Vienna. Now, for those of you who are not using Q potencies so much, those are quinquagintmillesimal potencies, and there's a quantitative application of 2.5 milliliters dilution onto 50,000 levels. First, there was a titration until CH3, followed by dilution and succussion. And it was Hahnemann's last discovery in Paris, only published in his last edition, in the 6th edition of the Aude Sapere book. It makes a mild influence on the patient, and it allows a quicker healing by frequent repetition of the homeopathic medicinal product with no side effects to the patient. This is Mrs. Muchic. She's a pharmacist at this pharmacy in Vienna, and she's very keen, also working very much with the European Committee for Homeopathy. Now, our analysis comprises finally 373 patients. There was a comparison with the first and third visit, which means baseline and 18 weeks. You remember we have the patients followed up every 9 weeks, and we use for evaluation the questionnaire from the European Organization for Research and Treatment of Cancer, the C30 form version 3.0 for quality of life. And in addition, we have a specially developed questionnaire which evaluates subjective well-being using visual analog scales. Those are the questionnaires in German language, but of course they're available in several languages. And this is a special questionnaire which we have developed, also asking for preferences or opposition towards homeopathic medicine. Now here you can see the table which shows that there was no significant difference in the basic demographics. There was no difference with respect to age or gender, and most of the patients included suffered from breast cancer, but also some other types of cancers were included, and there was no significant difference with respect to metastatic disease, chemotherapy, and frequency of radiation. This is a flow chart showing the assessment for these eligible patients, and some patients declined before randomization, before consenting to participate. So we randomized 410 patients, and still after signing informed consent, some of them declined to participate. And after the second and the third visit, altogether about 280 patients finally completed all 3 questionnaires. Now, those are the results. On the left column, you see the homeopathy group. In the middle, the control group, and on the right side, homeopathy versus control. Now, if you look to the left side, there is a significant improvement of global health status in the homeopathy group, and also for subjective well-being, and also for all the functioning parameters. Furthermore, for fatigue, pain, dyspnea, and only diarrhea is worsened. If you look to the middle column in the control group, you have an improvement of subjective well-being and of role functioning, but you have a deterioration of physical functioning, nausea, vomiting, pain, constipation, appetite loss, and diarrhea. Now, this was a comparison within the groups between baseline and 18 weeks. Now, on the right side, on the column, there's a comparison between homeopathy and control with regard to the difference between baseline and 18 weeks. And you see homeopathy shows an improvement in global health status, subjective well-being, and also functioning parameters, including also fatigue, pain, dyspnea, and appetite loss. So, to my knowledge, this is the first study comparing those two groups. And we also looked to other alternative or complementary methods where multiple answers were possible. And those were the remedies which were most frequently used in the treatment group. And still phosphor appears to have a very high importance in cancer patients. Now, we believe that this is the first prospective controlled study evaluating add-on classical homeopathy in cancer patients at the same center. And the global health status and subjective well-being of cancer patients improved significantly with homeopathy. Now, I will present a few case reports. 68 years old male, 3 years ago, he underwent cholecystectomy because of a cholangiocarcinoma, and it included also a partial liver resection because of metastasis. 8 months ago, there was a computer tomography showing no signs of a tumor. 1 month ago, the computer tomography revealed liver metastasis with a size of 4 multiplied by 2 centimeters, and also 2 pulmonary metastases. So the patient received chemotherapy with the side effects of nausea and loss of appetite. 4 years, since 4 years, the patient is known for a rectum carcinoma, and he underwent 3 times surgery. Since 7 years, he is retired, he hikes, and he makes much exercise. He performs a lot of sports, and therefore he is suffering from injuries of the knee and left shoulder. And his symptoms are perspiration on his head, especially. He desires eggs. He shows a flabby tissue, a dominant demeanor, and he's very headstrong. So, first of all, I gave him Strychnos nux vomica, and in an LM6 potency and the Q1 potency of calcium sulfuricum. After 38 days, there was no improvement with nux vomica. Patient reported increased flatulence in the lower part of the abdomen, nausea, and loss of appetite. Now I gave him lycopodium Q1 and Q2, and after 44 days, the patient reported less side effects, while nausea and appetite improved. 1 month ago, the computer tomography showed that the lungs were unchanged, and there was a cystic regressive transformation of the liver metastasis observed. The chemotherapy was continued, and we continued with the next higher potencies of lycopodium. You know, usually Q potency is given for 3 weeks, so now we have the 9 weeks cycles. After 70 days, the patient complained of headaches, as if someone would stab a scalpel underneath the scalp from below. You know, it's like the Indian population in North America. Yes, they took a scalpel and they removed the scalp. Now, I looked to the Roberts as if symptoms book, and the symptom is described loosened from back of head, as if the scalp were loosened from back of head. Furthermore, there was nocturnal perspiration over the whole body. Now, the repertory describes calcium carbonicum, and I started with Q1 to Q3, and 69 days later, the patient reported that the headache has ameliorated. However, there was another side effect of chemotherapy. The patient experienced a sensation in the feet as if the feet were inflated and suddenly the air fades. So it was going on 50 times day and night. It lasted only seconds, but it was very painful. Now I look to the Roberts, and the symptom, the feet were bloated, and there was also a symptom described in the complete repertory, sensation of swelling foot. Now, if there were several homeopathic remedies described, but I said maybe Arsenicum metallicum is the one which I had not used so far, and so I described it in a Q1 and Q2. And the sensation of the inflation in the feet disappeared following the administration of Arsenicum metallicum. Chemotherapy was continued with Xeloda, capecitabine, and irinotecan and Avastin, and the side effects were diarrhea and bloody stool. So I gave the patient Hydrargyrum picturatum or Mercurius corrosivus, and then the patient did not show up for a longer time, but after almost 150 days, the patient reported that he tolerated chemotherapy very well, and the diarrhea had disappeared very soon after Mercurius corrosivus. A 63-year-old male patient was suffering from stitching pains in the left knee, even during rest. And 5 years before, injections had been performed to build up the cartilage. He was playing tennis for 15 years. You know, Austria is a tennis nation, and Dominic Thiem is always very active. If you watch tennis now in Paris, he lost, but otherwise he's doing fine. Now, 3 years ago, he received the diagnosis of a hypernephroma with a metastasis at the left knee. So it was a renal cell carcinoma. Interesting thing is, the carcinoma was sitting at the medial aspect of a horseshoe kidney, just in the middle. So it was sitting there. Now, after radiation and partial nephrectomy, the patient now has 2 kidneys as we have, because the middle part has been resected. Furthermore, he received chemotherapy with capecitabine, at this time with interleukin and interferon. The side effects of capecitabine are exanthemas of the hands and feet with desquamation, cracking nails. And the side effects of Proleukin are shivering and fever, while Imokin might produce nausea. Now I look to the different symptoms, and I found out that the sulfur was represented in almost all rubrics. The special burden for this patient was he was suffering because his wife had died, was suffering from a chronic lymphatic leukemia since 3 years, and I started with sulfur Q3. At this time we didn't have Q1, but later on we started all the Q potencies with Q1. 47 days later, the patient reported that the desquamation of the palms was far better, but not on the feet, not as good as the hands. The skin was still red, but less dry, less cracking of the nails. So I continued with the sulfur Q4 dilution. 37 days later, the patient said that his hands were still fine and the feet better since May. Then I looked to the childhood symptoms, and at this time he had small warts on the left forehead, back and hands. And at this time, those warts were irradiated. And therefore, I prescribed 2-year Q1. The feet now became even better. The hands were excellent. Unfortunately, his wife died 1 month ago, but the children were taken care. All the laboratory parameters improved, and there were no signs of tumor. So just because of this silent grief, I prescribed Ignatia and Natrium muriaticum. Now we call it, in my country at least, Natrium chloratum, but I like, of course, sodium Natrium muriaticum much more. Now, the natrium chloratum helped to stabilize his emotional situation, but still the patient reported that he was feeling cold and he had fever during the application of Proleukin. So it appeared to be very similar to influenza-like symptoms, and I prescribed Echinacea purpurea. Maybe today I would prefer to prescribe Eupatorium perfoliatum. 40 days later, he reported that there were no more signs of fever during the Proleukin injection. And 1 year later, he said that he had a wonderful subjective well-being and a new girlfriend, and he was doing fine. Now, Professor Schlappack had performed a study regarding radiation-induced itching in breast cancer patients. It was a prospective observational study without control patients and published in Homeopathy in 2004. Now, he chose single homeopathic medicinal products individually and administered it as a 30 CH potency in clinic following the repertorization. Patients had to complete visual analog scales before prescription of the homeopathic remedy and at follow-ups. Evaluation was done after a median of about 3 days, and 14 out of 25 females, so 56%, reacted positively to the first remedy. 9 patients received the second remedy, and 7 of them reacted positive. So altogether, 21 out of 25, so 84% of the patients could be treated successfully. And now, if you look to the visual analog scale measurements before and after homeopathic treatment, a reduction from a median could be shown. But of course, this was an open study. It was not double-blind or whatever. But still, I believe that patients know very well about their subjective well-being. The following homeopathic medicinal products were used successfully: Acidum fluoricum, or also called Acidum hydrofluoricum, Rus toxicodendron, Causticum, Ignatia, Psarinum, X-ray, and Kalium picromicum. So most often effective was Acidum hydrofluoricum for the radiation-induced itching, and it appears that homeopathic treatment can be very successful in this situation. Now, regarding to side effects, postoperative side effects, there's a 58-year-old male suffering from a carcinoma on the root of the tongue with an extracapsular growth. 5 months ago, his disease started with enlarged cervical lymph nodes on both sides, more on the right and on the left side. And 1 month ago, a laser resection at the root of the tongue was performed together with a radical neck dissection on both sides, including tracheostomy. The surgery lasted for 13 hours. So for an internist or internal physician like me, this is an incredible time, and I could not do this. He received then chemotherapy with cisplatin and radiation. Currently, he suffered from swelling of the lower jaw and chin. He is unable to open the mouth widely because of swelling. He reported dry mouth, the chin is insensible, voice is indistinct and quiet, and during the night he is breathing stertorous, is showing stertorous breathing due to open tracheostomy. And during the night, foot remnants and ropey mucus was released from tracheostomy. The trigger of his disease might have been that his 93 years old father had died 8 months ago, but still the patient was very much affected. The father had died after 14 days of severe suffering in the hospital, and the patient had to observe a slow dying, falling apoplectic insult. The patient swallows while he is talking about his father, but he refuses consolation. Furthermore, he reported that he was very angry with regard to his profession after 40 years. There was silent grief, he felt utilized, furious, and he couldn't tolerate injustice. He was smoking for 30 years, about 20 cigarettes a day, and since father's death, he increased the nicotine abuses up to 40 cigarettes per day. Now, postoperatively, the patient felt that when he was drinking tea, it burned on the base of the tongue. Swallowing was difficult. There was ropey, tough mucus, transparent as chewing gum. And as a child, he had undergone a phimosis surgery. He is very thirsty. He drinks 1 liter milk a day as an adult. He's married. He has 1 daughter, 1 grandson. 15 years ago, another grandson had died because of sudden infant death, and this has affected the patient very, very much. From character, he is very sensitive, he's very caring about everything which was told by his wife. He's anxious about his family. He's hot-tempered, however, he is not resentful. He displays aversion to company. He likes animals and spends much time controlling bees. As a hunter, he uses 5 different high seeds, and there was an event which has affected him very, very much. He had a 15-year-old hound which suffered from epileptic fits. So the patient shot his hound to death. Now he reproached himself. Why did I do that? Now I gave him Ignatia Q1 and Q2, and 60 days later, he said that there was no more burning feeling with the tea at the base of the tongue. However, drawing pain in teas with cold and warm food since radiation. So I think this could be phosphor, and the tip of the tongue felt as if burned, and the nerve and muscles were cut through. Now, if you put all the symptoms together, the swelling of the gums, the fear something might happen to his family, dryness of mouth, the feelings that the tongue is burned, or as if the tongue is burned, numbness of his face, a tendency to anger, aversion to company, expectoration of tenacious mucus, and indistinct speech. So phosphor appears in almost all these rubrics. So I prescribed phosphor Q1 and Q2, and with a follow-up 93 days later, the lymph nodes of the upper jugular group had disappeared, but he was also radiated. The sensation of cold was much better, voice was much better, and it was better to understand. There were drawing pains of the teeth with cold and warm food were reduced, and the weakness was decreased. 2 years later, he complained about cramps at the floor of the mouth, which were aggravated by fresh air coldness. There was a feeling as if they were repelled around his neck. MRI and ultrasound revealed a 90 millimeter fluid-filled cyst at the root of the tongue. The biopsy showed a benign tissue. Now I look to the generalities, the tumor cysts, and I decided to prescribe barium carbonicum, Q1. And 27 days later, the patient said barium carbonicum was like a hammer. 3 days after intake, there was a burning in the urethra and tearing in the nipples, more on the right than on the left side. You know, the nipples were sensitive after radiation. There was 2 times epistaxis within 4 weeks, a burnt feeling. The burnt feeling of the tongue had completely gone. The sensation of the cold palate was much better. The swollen feeling of the palate was better. And also the neck cramps were reduced significantly. Now, another patient I choose because I think there were some blockades being responsible for the development of his disease. 77 years old male patient, 3 months ago. He suffered from severe burning pains of both sides, more ventralis and dorsally. And the laboratory test revealed anemia, and therefore he underwent coloscopy and the colon carcinoma was diagnosed. 2 months ago, there was extended surgery, and in addition, the patient was prescribed capecitabine as chemotherapy. His history was almost clean. Only 50 years ago, he exhibited hemoptysis with ventricular and duodenal ulcer, and at this time a Billroth 2 surgery was performed. You know, Billroth was a German surgeon who had come to Vienna, and he was very, very famous, and he also did a lot of music together with Johannes Brahms, and he also had founded a very beautiful location for lectures for medical doctors, which is still existing, the Billroth House. So whenever you come to Vienna and you have a chance, I think this is a very nice area to look at. He was conscientious about trifles, and due to a wasp allergy, he underwent desensitization. Now, if you look to all these symptoms, I've decided to prescribe Arsenicum album, Q1, and 1 month later, he did not report very much. So at first, I had the feeling there was no reaction at all. But then he reported since 3 weeks, he exhibits massive bloody nasal discharge when he was blowing the nose. And 2 years before the diagnosis of the colon carcinoma, there was a similar bloody discharge which was obliterated. So I believe this was Herring's law, so it's an old symptom has come again. And of course, I believe that obliteration of epistaxis is not a good idea. Unless it is, you have no way to stop something. I advised against a new obliteration, and 6 months later, the bloody nasal discharge had disappeared. So I believe that the recurrence can be viewed as solving of a blockade, because with the obliteration, the release of the blood was blocked. And once in a while I was flying, and the flight attendant asked for a doctor, because a young boy who was suffering from massive epistaxis, and I went there with my small emergency kit, and I decided to give the patient phosphor, and I've never seen this before. Just within a second, the bleeding had stopped. Now, Montessori has done studies investigating quality of life data as prognostic indicators of survival in cancer patients. And this was a review of about 30 years. But of course, all these papers were with conventional medicine, no homeopathy. And assessing 450 studies, he demonstrated evidence for a positive correlation between data regarding quality of life, or some measures towards quality of life and survival of cancer patients. So I think this is something most of us might have, be able to observe, that patients who have a good quality of life, of course, have a better survival. Now, I believe that homeopathy in oncology might serve as a valuable tool to improve global health status as well as subjective well-being. And when applied professionally, no adverse effects, no interactions with other medical interventions might be observed. An increase of life quality might improve prognosis. Now, some years ago, a student at this time, Katrina Gartner, he investigated survival data of cancer patients with advanced stages of cancer, and those who had utilized additive homeopathy. And what could be found that using a special landmark statistical method, it could be found that those patients who were still alive at 6 months seem to have some survival advantage when already taking the homeopathic additive homeopathy. Now, publication soon. It's already published. We have done a study with additive homeopathy in patients with non-small cell lung cancer at the Medical University in Vienna and at the urban hospital, together with 2 other hospitals in Austria. It is a prospective double-blinded, placebo-controlled, randomized multi-center study with 3 groups. One group received double-blind placebos, the other group double-blind WissHom homeopathy, and a 3rd group included those patients who refused to participate in the study, but they were positive, that we just looked at survival without any homeopathic interventions. So we wanted to exclude the possibility of any influence of the homeopathic investigator on those patients. Now, the quality of life improved in the WissHom group, and survival improved also in this WissHom group. I had sent just some time ago, but I couldn't make it earlier. You can just look to PubMed. If you go to PubMed and if you write Frass-M, then you will find this recent paper in The Oncologist. Unfortunately, this is a preliminary version that the editors gave this online, but I didn't have a chance to edit this paper so far. Now, as homeopaths, we are always confronted with arguments that it is only placebo. But if you look to the literature in New England Journal of Medicine, but also in a Cochrane publication, it could be shown that placebo had no significant effect on binary outcomes as compared with no treatment. So, regardless of whether these outcomes were subjective or objective. And the authors conclude that there was little evidence in general that placebos had powerful clinical effects, and although placebos had no significant effects on objective or binary outcomes, they had possible small benefits in studies with continuous subjective outcomes and for the treatment of pain. And outside of the setting of clinical trials, there's no justification for use of those placebos. I think it's very pioneering research done by Dr. Rajendran in India, and he discovered nanoparticles in all ultra-high dilutions of homeopathic drugs, prepared from either metals, minerals, plants, no salts, and so on. And so he established for the first time that homeopathy is a material science and individualized nanomedicine. Of course, also this study has been criticized, and a single study can never prove or disprove anything. It's just a very, very important first step. Just to give you an impulse, there was a study at the Technical University in Vienna in Austria, which had nothing to do with homeopathy, but what really amazes is that a single atom of americium is able to change the crystallization behavior from hundreds of millions of terbium atoms. And in a conventional view, this finding might have a relevance for the future of nuclear repository handling and safe long-time storage, which is one of the greatest challenges in nuclear sciences. And if you look to a comparison of treatments versus placebo, you will find that when all criteria for reducing bias were ruled out, placebos were more effective than treatments, but this is they have all similar effect sizes. Now, the corrected analysis revealed no statistical significant difference between placebo effect sizes and treatment effect sizes in all but two subgroup analyses. So I think placebo is a complex topic which should be used very carefully. What I think is very important would be the collaboration between conventional and homeopathic doctors, which could improve, and a mutual respect between conventional and homeopathic doctors is beneficial for the patients. And combination of conventional and homeopathic medicines might improve global health status and subjective well-being in cancer patients. Now, this is my new life, retired since 370 days. Now, I know my wife for 5 years and married for 500 days. Now, many greetings for the doctors from the Doctors Association for Classical Homeopathy, from the Austrian Society for Homeopathic Medicine, Austrian Society for Veterinary Homeopathy. The president, Dr. Petra Weiermeier, she has just published this paper in the Swiss Journal for Veterinary Medicine, and also the Students' Initiative of Homeopathy. Thank you so much for your attendance, and I'm looking forward to stay in touch with you.
Thank you so much, sir. Thank you so much, sir. It was a wonderful presentation. We really enjoyed the whole session and got to learn so many, I would say, numerous things. Ma'am, can we have a question answer session, Kavita ma'am? Kavita ma'am?
Hello? Yes, Yashika?
Yes, ma'am. Can we have question answer session?
Please go ahead. Please.
Can you please announce it again for sir if sir doesn't get my voice.
Okay.
Yeah. So first question is homeopathic medicine for repairing the fouling joints in old age.
Okay. Dr. Frass, there is a question for you. Homeopathic medicine to repair the fouling joints in old age.
Can you please repeat?
Homeopathic medicine for repairing fouling joints in old age. This of old age.
For old age, maybe you can just write it. So.
Okay, I will type for you.
Thank you so much. It's a very good question.
Indeed, indeed.
If I find the solution, I think I would I would become famous. I believe, of course, Rustox, Bryonia, Kalmia, Ledum might be the most important remedies. Maybe for the fingers it is causticum, but in any case, of course, I think I try to find the individualized remedy which fits best to the patient.
Okay. Thank you. Thank you. Yashika, any more questions?
Ma'am, only this question was there. He also wants to know if we can avoid to change the joints in old age. Any homeopathic medicine we for avoiding to change?
Okay, okay. He has already told about Rustox, Ledampal, and all other remedies Dr. Frass has addressed. And one more remedy, I think, will be Germanium metallicum for such condition. So you want me to ask him the same question again?
No, ma'am, thank you. So it's okay. I request the audience to please type the queries if you have any. We have a great personality, a great expert to answer all. So kindly post the queries in the chat box. We can wait a minute. By the time you can express your views, or Dr. Hashmi wants to express his views on the session today.
Yes, I think Dr. Hashmi should do this. He is president of AHMA. So I think he should do it. Dr. Hashmi, please. Your mic is off. Dr. Hashmi can't hear you. Can't hear you.
Yes.
Yes.
Am I audible? Okay.
Yes. Yes.
First of all, I want to say thank you, Professor Dr. Michael Frass. We are really happy and lucky to have you in this session in our association. We are very glad, and we are proudly, I can say, we are success because of you, sir. Thank you so much for being a part of AHMA. Not being the part of AHMA, it's yours own. One is my messages. Sometime I circulate in the social media. AHMA is the equal property of all members. But we are really happy and lucky to have you and Dr. Kavita in this program. And it was very nice and very academic session. We heard from you, and I have noted so many points that I haven't heard before. And thank you so much, sir. And thank you all audience for being with us. And once again, really sorry to Dr. Michael sir for a technical issue that we could not contact the first of starting the webinar. And all audience, I can say really sorry for that, but next time I hope we will not have any technical issue further in this webinar series of Revolutionary International Webinar of AHMA, Afghanistan Homeopathic Medical Association, and 360 Homeopathy by B. Jain Group of Companies. And thank you once again. Thank you, Dr. Manish, B. Jain Director, and thank you, Dr. Kavita, for your collaboration and for being with us. And special thanks once again. We're really proud. Not the AHMA. I will announce. I announced specially a few days before in the Medical Council of Afghanistan that we have the most legend of the world is Dr. Michael Frass with us, and I have distributed so many. I have made a copy of your brochure, and you know, sir. Even the Deputy Minister and the Director General of the Ministry of Health of Afghanistan, they were very, they really appreciate you, and they were trying to see your some lectures. And I will forward whenever this this video will be recorded. I will forward it to our Ministry and the Medical Council of Afghanistan, inshallah.
Thank you so much. I'm proud to have the opportunity to speak here.
Thank you, sir. Thank you. Proud of you, sir. It's lucky to have you. Lucky to have you, sir. Thank you. And thank you.
Thank you.
Thank you once again. Thank you, Dr. Yashika Arola, for organizing this program, and for you know, there was a little bit problem has been occurred, but you handled very gently, and thank you so much for that.
याशिका कुछ और पूछना है बेटा?
हाँ जी मैम, there is a question. There are 3 questions actually for regarding COVID. So people want to know best frontline COVID remedies in his view, in sir's view.
Okay, I'm sending him one question. I'm just typing it. He will answer the first question.
Sure, ma'am. And you can, along with that, you can ask him no-sort miasmatic remedies also.
Okay.
Both the questions.
Okay. Okay.
I think the fatigue remedies are numerous, and I think the most important might be sulfur, for example, but also gelsemium, and also some remedies such as Lobelia purpurascens and Bryonia, of course, I would say. So I think the main remedies which might be helpful, and also influenzinum. Influenzinum has been used by a colleague in COVID patients several times with big success. So I think those might be the most important remedies.
Okay. Sir, one more question. I sent you.
I think yes, influenzinum and tuberculinum might be a second no-salt, which might be used in COVID patients. Of course, our experience is limited, so I have just an overview with my colleague who has treated 13 patients in a rural hospital, and we have put together these findings, and we want to include those in the clinical registry. But you know, the number of 13 patients is very small. The good message is that 12 out of these 13 patients did very well. The patient who had died, he was already very, very bad, in a bad state when he arrived at the hospital. And if I remember correctly, 6 out of these 12 patients had been on the intensive care unit. So I think this was a very good result. It looks very promising for the future. And I'm perfectly sure that Donald Trump has received homeopathic medicines, so he recovered so quickly. Of course, it was a joke.
Thank you. Thank you. Any more question, Yasha?
Thank you, ma'am. Ma'am, by chronic fatigue remedies only, you wanted to know sword miasmatics, so it's done. I think no more questions yet.
Okay. Okay. I think we should wind up.
Yes, ma'am, we can wind up the session. So finally, I would like to thank Dr. Michael sir, Dr. Michael Frass sir for being with us, and Dr. Kavita, Chandak ma'am, and Dr. Obaidullah, Al-Hashmi sir. And it was a great support from you all, and I enjoyed the session personally, as well as I hope the audience enjoyed. So I would request the audience to join us back tomorrow. We have another great speaker who will be joining us tomorrow, and you can visit. You can know about the speaker as well as the topic of interest. So that would be a great knowledgeable session, and I am sorry for the technical issue which happened today. It won't be repeated tomorrow. So that was due to the linking of YouTube and software that happened because so we had to stop the YouTube live link. So now I think, tomorrow there won't be any issue and no issue in the upcoming session. So tomorrow we have Dr. Elizabeth Tiros, ma'am. She's she's a member of Homeopathy World Community and an executive committee member of AHMA. And she will be talking about Alzheimer's dementia patients and the quality of life, how to improve the quality of life using homeopathy. So I hope people would be joining us tomorrow, inshallah. So thank you so much, everyone, and hope you enjoyed the session. Thank you, Michael sir. Thank you, ma'am. Thank you, sir.
See you, Yashika. Bye. Bye. See you, Nikhil. See you. Thank you so much. Thank you.
Bye, ma'am. Bye.
Namaste. Namaste.
Thank you. Thank you.